Hello everyone, welcome to US Residency Training and Beyond. I am Dr. Viswanath Aluru, attending physician in physical medicine and rehabilitation at Oxford Health in New Orleans. In this video, we will continue with our topic patient care. Once you are done with your morning patient rounds or pre-rounding, as I said, pre-rounding can be by yourself or with your senior resident or chief resident. You must and should attend your morning report. So try to see as many patients as possible before morning report, and if you're unable to complete seeing all your patients, you should definitely go to the morning report first on time and then come back, finish your rounds. So what you should do is when you print your list in the morning at the sign out, you should divide your list into the patients that you need to see for sure, like first thing in the morning. There are certain patients that like high risk patients that have to be seen, and there are some patients not so high risk patients like maintenance rounds, so that can be seen little later. So in that way you can prioritize which patients you want to see first and then which patients you want to see later. So as soon as you finish all your rounds, try to finish any new orders that you have to enter, any referrals, means consults, and also check on the labs, any morning new labs or repletions that needs to be done. So and all those things need to be taken care of as soon as you finish your rounds. And also another important thing is progress notes. So as a resident or intern, you're expected to see your patients every day and drop in a progress notes. The progress notes mainly, as you know, it's a SOAP format, subjective, objective assessment and plan format. Subjective involve or include the information for that day. So what's your conversation with the patient? What did patient complain of anything that's going on? Are there any pertinent findings during your visit to see your patient? Any change in plan of care, change in medications? So include all those things. Your conversation with the patient, how the patient feels about the overall well-being, being in the hospital. Those kind of is a subjective experience of the patient. And then objective is your evaluation for that day. It would include vitals, physical examination, mainly review of systems, those kind of things. You can include in labs, you must include any new labs for that day, and then your assessment and plan. Usually what you can do is you can take your assessment and plan from your admission note, and then you can add stuff to it so that the admission note, assessment and plan gets updated from day to day, and in that way you can keep track of things also. So that's your progress note. So try to finish the progress notes as soon as possible. Either in the morning, you can do them throughout the day, but definitely try to finish them by the end of the day. So now going back to the morning report, especially the morning report is important if you're like an on-call physician. So if you're on call the previous night and you have admitted or you have seen patients in the emergency room, or you have admitted certain number of patients, so the morning report is mainly for those patients that came in after sign out yesterday. So there you have to be prepared to present those patients that you have seen or you have admitted throughout the night, so that the morning chief resident for that service or the attending physician will actually give you valuable insights and input. You can discuss the plan of care and get modifications or any further recommendations on the plan of care. So for the morning report especially, you have to make sure you have to explain why the patient presented, how the patient presented, what was the initial findings, and what's the plan you recommend for this patient, and what things need to be done in terms of like workup or in terms of management. What's the further plan of action? Okay, so you have to make sure you have all the things ready for you, like open your admission note and open any pertinent imaging findings, any labs that you want to show during the morning rounds. So just be prepared so that it goes smoothly, because the attendings of the chief, they are going to ask you specific questions like why this patient came to the emergency department, or why this patient went to the operating room, or why this patient got admitted to the rehab floor. What are your imaging findings? What are the labs? What is the management that you are doing for this patient? What are your plans, specific plans? So that's what the morning report is about. So as soon as you finish the morning report, you go back to your floor work, finish rounding, finish any entering the labs, orders, try to finish some progress notes, And also you have to keep in mind that pre-rounding is that rounding that you're doing on your patients either by yourself along with your senior resident or the chief resident, but there will be rounds with the attending physician. So always be mindful if the attending physician calls you or sends you a message saying that hey, I'm having some time now, so just go round on the patients. So if it is a surgery program, because the surgeons will be super busy first thing in the morning taking care of the patients in the surgery operating room, so whenever they find in between surgeries, they usually want to round on their patients. I was in the rehab for my advanced training. Usually in the rehab, I used to round with my chairman or the attending in the morning, and then get the plans, recommendations that way. Or they used to round in between clinic time. So you should be mindful about those messages or calls from your attending. Make sure you are available when they want to round. So you should be leading those rounds and then tell the attending what's going on with each and every patient, why they are here, are there any changes in their plan of care. So give your recommendation, ask them for any further recommendations, and make a note of all those important things that you discuss with the attending during the rounds. So as soon as you finish those rounds, you can make changes or update your plan of care in your progress notes. So those attending rounds are also very important. And one most important thing is go prepared for those attending rounds, especially for any new admissions that came the day before or that morning, because they're going to ask you some very specific questions because they know about all their patients. But say for example, if the patient got admitted for like a GIB, right, they're going to ask you about what's the CBC, right, or pre-trending hemoglobin, hematocrit, right, or the patient had like a liver transplant, they're going to ask you about the trend in LFTs, or if it's a kidney transplant, they're going to ask you about trend in renal function test, right? Or if the patient, you're a rehab resident, you're on a rehab floor, you're rounding with your attending, they're going to ask you about what's the progress in rehab therapy, like are there any impairments that is actually causing any barriers to participation in therapy, and how are they doing in therapy, like are they able to walk with a walker, are they able to perform their activities of daily living, and how much assistance are they needing. So those are the things that are pertinent to the patient that you have to be aware of and that you have to be prepared. So you should definitely go prepared for the attending rounds. That's why it's important that you do this pre-rounding with your senior resident chief resident, so they will give you some plans, recommendations, and then when you go to your attending rounds, so you will have information. Of course you should be always thorough with all the plans, all the background information about all your patients that you're following on a day-to-day basis. That's in regards to your attending rounds. One important thing I wanted to mention in this video is whenever there's an acute change in the status of the patient, sometimes say the patient had like a syncopal event, right, or the patient is unresponsive, or the patient has severe tachycardia or hypotensive. In those situations, the nurses will alert the staff on the floor. Sometimes they will text you or call you, or sometimes it will be like an overhead announcement, like a rapid response that we call it. So that whenever there's a rapid response or acute change in status of the patient, you should stop everything that you're doing and attend to the patient immediately, because they call this because they try to get as much help as possible so that the situation can be addressed as soon as possible. And if you think it, so immediately you should go to see the patient, evaluate the patient, and check the vitals, check the blood glucose, make sure the patient is stabilized, make sure the patient is alert-oriented, neurologically intact or vascular intact. All those things need to be evaluated. But if say if the patient goes into an unresponsive state, then that becomes a code status. Then you should immediately call a code situation. In those situations, you have to alert the entire code team. So if you're in an acute care hospital setting, there will be like a code team that involves internal medicine people, involves ICU people, anesthesia people. So whenever there's a code situation, everyone will be on the floor. They will try to intubate the patient, then they will transfer the care to the ICU or CCU. But if it's a rapid response, you should definitely go to the bedside immediately, evaluate the patient, check the vitals, check the labs, check the background information about the patient, see what's going on with the patient, what medication the patient received, and try to examine the patient, see if the patient is alert, oriented, able to answer your questions. If the patient needs transfer to the emergency room or transfer to medicine department, that needs to be taken care of. So that's why these rapid responses are very important, that you have to be aware of and attend to immediately, setting aside rest of the work that you have been doing. So with this, I'm going to end this video. We will continue with our patient care topic in the next video also. Thank you for watching my videos. I will see you all soon in the next video. Thank you. Bye.